Mahala Jacobs. I work for Metagenics. We are the company that makes the Ultramel 360. And I'm going to talk to you a little bit about what exactly it is and how it can help with treating metabolic syndrome. Okay, this is a very interesting fact. The study that they did with over 180 overweight subjects over a 2-year lifestyle program, they found that 48% of them had a net reduction of, had weight loss using the Mediterranean diet alone. Is everybody familiar with the Mediterranean diet? Basically, it's meats, vegetables, fruits, not too much meat, protein that's, your source of protein is not just meat, it's also other forms of protein. Okay. So these patients went on it for 2 years, and it took them 2 years for them to see a good reduction of weight. Okay. In this study, where they added the Ultrameal Plus plan to the Mediterranean diet, we found that the number of subjects that lost weight was actually double, and it only took 2 weeks. It was a 12-week interventional time frame, as opposed to back here in this study, it was a 2-year period. Okay, so adding the Ultrameal Plus 360, which is the powdered drink mix that comes in the kit that we're going to be talking about in a few minutes, adding that to the diet made a difference over the 12-week period rather than the 2-year period. Here's another study where 89 women with metabolic syndrome were studied, and this took place actually at the University of California and the University of Florida and the University of Connecticut. It was a 12-week trial as well, and 44% of the subjects in the treatment arm saw a reduction in those factors that contribute to metabolic syndrome over the 32% in the control arm. Okay. So if you do have conditions that would put you under that umbrella, I like the slide that was up a little while ago, and Dr. Lindholm showed all the various, it's like the web of conditions. We here address 5 of those conditions. 3 out of the 5 is, the most common: the triglyceride levels, the cholesterol levels, the fat, the blood pressure levels. But if you're at that crossroad and you have a choice to either continue on to developing full-blown metabolic syndrome or taking part of an intervention plan, it's always better, of course, like he said, to listen to the doctor and try to take advantage of a situation before it becomes even more dramatic. I know I have some friends that have diabetes, and it's it's the worst thing. It's so limiting, and it really takes away a lot of your overall sense of well-being and just your life. So with all the studies that were done, with all the research that was done, people that were studied, we found that there were no side effects, no adverse events when people were on the Ultrameal plan. Okay? It's a very safe plan. And it's perfect for patients with metabolic syndrome who just want to, or patients that just want to achieve an overall healthy lifestyle. So, and this is important to point out, in both clinical trials, patients lost an average of 1 pound a week. So that's huge. I don't, if you go on Jenna Craig or any of those other weight loss programs, and that's pretty good. Just to piggyback on this comment here, I know that a Victoria's Secret model was interviewed right before they did the fashion show, and they asked her, they said, well, what do you do to get ready for the fashion show? And she said, well, I take Ultrameal, Metagenics Ultrameal. And the next day we got calls from all over, people wanting, young girls wanting Ultrameal to help lose weight. So.
And you said, and she wasn't being paid by Metagenics?
No, she wasn't. She just, there's a doctor, actually one of the we do private label. Metagenics does private label, and there's a doctor in Hollywood that all the stars go to, and his private label is Metagenics. So she just happened to know that it was Metagenics. So that was funny. Okay, so there's other benefits to not just losing weight, but you're also going to see reduced cravings. You know, I know I have a sugar and insulin resistance kind of problem, and I know that since I've been on the Ultramil myself, my energy levels have skyrocketed. I don't crave sugar as much. And when I say sugar, it's not just candy. We all love candy and chocolate. But I'm talking about the pasta, the rice, the bread. I was addicted to bread, and I had no idea, did not realize that even bread can cause problems if it's not a good whole grain bread. We all love our white bread. Who doesn't, right? But you know, I noticed a dramatic change in just 2 weeks that I was on it, and I have my own personal story when it comes to you know, eating more healthy and just doing things in a more healthy way, and it does really improve so much of your life. Okay, it's easy to follow. It's designed with a targeted nutrition plan. It's a healthy eating plan. You just do simple exercise, and in the guide that you'll get with your kit, it'll give you some recommendations on just stress management techniques. So it is an easy plan, and because of that, a lot of patients do stay compliant with it. Okay, this is the guidebook that you will get with your kit, and it basically walks you through. It's a comprehensive program. It walks you through the nutrition, the eating plan, the exercise, tips for the exercise that you should be doing, and tips for stress management. And it's a complete guide. And what I love about this guide is that you can actually track what you're eating each day, and you check it off as you eat the food under the food category. So, okay, it's this is a medical food, and it is. We do have claim that it is for those patients with metabolic syndrome and cardiovascular disease risk factors. And when I say that, I'm going to explain what a medical food is. Medical food is basically it's been approved by the FDA, and you've probably heard of functional food or supplements. This is not a supplement, and it's not a functional food. This is a medical food. It is approved by the FDA, and it's specially formulated and intended for treating metabolic syndrome, so we can make that claim. Okay? And this is important to point out, all efficacy claims must be based on recognized scientific principles and sound clinical data.
Okay. Can I mention real quick there that medical foods, an important distinction is that they're kind of like halfway between a prescription drug and a supplement. So it's regulated by the FDA. They're only supposed to be sold through a healthcare provider like a medical doctor or a chiropractor or an osteopath. So they are very different from something you would get where you just buy a whey protein powder at GNC or at Walmart or something. So it's a very targeted food designed for treating specific issues related to body composition. I'm sorry about that.
That's okay. That's a great point. That, you know, you can't just, Metagenics products are not available to the public. You have to go through a doctor to be able to purchase them, because they're very potent. And as I'm sure Dr. Lindholm will talk about this brochure. It talks a little bit about Metagenics, the company, and the efficacy and potency of our products, and how we can back what we're saying. But he'll go through that. Okay, so it is a low glycemic index formula to decrease the insulin burden, and the results of more than 15 published studies demonstrate that you will have an increased satiety, you will have less cravings when you're on the Ultramil. Okay, the soy protein, it helps to improve body composition and lean muscle mass, and the FDA states that diets low in saturated fat and cholesterol that include 25 grams a day of soy protein can reduce or may reduce the risk of heart disease. With that said, the Ultra Meal Plan, it's 2 servings. Each serving is packed full of 15 grams of this type of protein. So you're getting actually 30 grams of protein a day. And the National Cholesterol Educational Panel of NIH recommends the consumption of 2 grams of plant sterols daily, along with a healthy eating and exercise plan to reduce the risk of cardiovascular disease. And studies have shown that 1.3 grams of plant sterols per day are needed to show a significant cholesterol lowering effect. And in our product, we get 2 grams. Okay. So 2 grams of plant sterols. And this is important to talk about selective kinase response modulators, the SCRMS technology. When you look at the bottle of Ultrameal, it's Ultrameal Plus 360. I can just show this. Some people might have this with them, but it's basically, it says Ultrameal and then it says Plus 360. The Plus 360 is the SCRMS technology added to the Ultrameal. I'm going to talk just a little bit about it because I don't want to get you too confused, but basically it's to help with the inflammation that's occurring inside the body as a result of whatever your genetic disposition is. So if you're predisposed to have an arthritic condition, let's just say you inherited a genetic, in your gene to have arthritis, and you'd start developing symptoms very early in life, and you're wondering, I'm young, I shouldn't be experiencing this. That genetic expression has begun, and it's a result of the inflammation in your body, no matter how old you are. You want to get that inflammation under control, and a good way to do that is to start at the cellular level, and what you want to do is improve that communication between cells, the signaling, so that you can calm down the cells, therefore calming down the inflammation. And the inflammation is what leads to that whole web of conditions that Dr. Lindholm was talking about. So that's the technology, that SCRMS technology, that's what it addresses, is the actual inflammation in your body. Okay? And if you reduce the inflammation, then you're going to see 35 times greater statistically significant decrease in TG levels, the triglyceride levels, 3 times greater decrease in fasting insulin, 87% greater decrease in 2-HPP insulin, 44% lower level in fasting glucose, and over 4 times greater decrease in 2-H-plus. And Dr. Lindholm can explain all those if you have any questions. And the triglyceride levels, they will go down, so that's another good thing that's going to happen if you just get that inflammation under control. Does everybody understand that? Okay. So, talking about the product itself per serving, it's a micronutrient profile to supply 35% or more of the RDI for most vitamins and minerals, including 600 milligrams of non-dairy calcium, 400 mcg folic acid, and the full spectrum of B vitamins. We all know how important B vitamins are. Everybody does. Okay. So here's the program, and if you've got one of these, you can take a closer look at it. But basically what it is, it's the Ultrameal Plus 360, the Ultrameal bars, and then your fish oils, and then a shaker cup and your patient guide. That all comes in the kit. And then for those that have a soy allergy, we do have a rice-based program for you as well. So you'll follow a modified Mediterranean diet with a low glycemic load, and basically it's very simple. It's just the meat, vegetables, fruits, and other sources of protein, not just meat. You gotta get the beans in, and the hummus, and all that good stuff.